Hello, it's Tom Exner here from Haematex. I'd like to talk to you today about some new developments we have with our DOAC-Stop product. As you may know, this is an adsorbent for DOACs, which removes them from test plasmas and allows you to obtain a baseline result on the underlying plasma. Recently, we had some requests to reduce the size of DOAC-Stop tablets for smaller volume samples from pediatric departments, for example. And we have made these micro tabs, as we call them, half the size of our regular ones and can comfortably cope with 0.5 ml of any test plasma. Another development we've made is we have a liquid form of DOAC-Stop available for different volumes of samples and also more suitable for whole blood than our current or former DOAC-Stop. The liquid form has been specially treated to reduce any effect on platelets or neutrophils or other blood cells. So it causes less hemolysis than using the tablets which we originally had. An interesting observation is that the liquid DOAC-Stop is super hydrophobic. It doesn't wet for pet tips, for example, and this makes it easier to dispense small volumes. It's only research use at the moment, but we'd be looking for feedback for its use in whole blood if possible. We've had an inquiry from the US whether DOAC-Stop binds Bivalirudin. It's also known as Angiomax. It's a hirudin-like anticoagulant. And we previously looked at Bivalirudin in a paper I wrote some time ago. Of course, this is back to front, is it? That won't be any good. And we found that Bivalirudin is removed by DOAC-Stop, although slowly. We repeated these tests more recently and found that, in fact, Bivalirudin is removed from plasmas just as quickly as it removes DOACs. So, yes, indeed, DOAC-Stop does bind Bivalirudin and it can be used for removing it from a patient plasma sample. We also had another inquiry came from the UK. Someone over there asked if the particles that are sometimes left over after centrifuging DOAC-Stop down from a plasma, what effect do they have on clotting tests? Well, we thought we would test this in our laboratory where we only have Stargo ST4 machines, and we spiked plasma samples with DOAC-Stop and found, much to our interest, that it had absolutely no effect. Perhaps not surprising because the Stargo machine uses a viscoelastic endpoint. But it does remain that you can get away without centrifuging the activated charcoal down if you're using a machine that measures clot physically. Of course, if you use an optical sensing coagulation machine, then it is very likely that DOAC-Stop may have some effect on endpoints, but we haven't tested that ourselves and hope that someone out there might have a look at that for us. That's all for the moment. We're continuing our developments around activated charcoal and DOAC-Stop. The product itself works very well now, and we look forward to having it used by many more people in the world. Thank you very much.